Your choice should be supported by those around you. Hello to all the beautiful birthing people out there. I want to welcome you back to my channel. Before we jump into today's video, which is going to be about formula feeding, I wanted to just touch briefly on my video that I uploaded earlier this week about wearing a mask in labor. In that video, I was trying to be intentionally vague so that I could kind of encompass any situation that you might meet out in the hospital or at home or in a birthing center when you deliver. But with my intentional vagueness, I kind of left off a piece that is pretty important. And some of you guys were kind enough to remind me of that in the comments. The thing I didn't talk about, the piece that kind of fits into all of this, that we talk about so much on this channel, is consent. So obviously nobody in labor can make you do anything that you do not want to do. Hard stop, period, end of story. And in this video, I wasn't in one way trying to say that wearing a mask in labor is good or right. I was just trying to address all the different situations that might arise. It is my hope we are able to do more universal screening and rapid tests so that masks in labor become obsolete. But even if that is the case, that video is still going to apply to just the differences that you're going to notice with your healthcare providers wearing a mask, which that video also touched on. I still think that those tips might be helpful, might help relieve some anxiety. That video was a requested video. It wasn't something that I was planning on doing. I just wanted to give a positive video on the options that you will be presented. But just remember that those are options. Those are recommendations. They cannot make you do anything in labor. So from that, let's get started on into formula. I know that there is a lot of talk about breast is best versus fed is best and kind of the clash of those two ideals. And I don't like either one of those. Let me tell you why. I think that when we talk about either of those things and we have the animosity that they have towards the other, it invalidates the people in the middle who perhaps wanted to breastfeed but weren't able to for whatever reason, or the people who are choosing formula, which is a wonderful and life-saving medical development, who are choosing that to feed their baby for whatever reason. I think what's important is that you are provided education on your choices, you are empowered to make the choices, and then you are supported in the choices that you made. More than saying fed is best versus breast is best. I think that those two both are too simple because we know that we need to feed our babies. But I want to make sure that I am supporting you in the choices that you are making to feed your baby, whether that is breastfeeding, whether that is formula. So the very first thing that I want you to know about formula feeding is that, and I hope that this doesn't even need to be said, but I feel like it does. However you feed your baby and make that choice, that educated and informed and empowered choice to feed your baby, is your decision and it's nobody else's dang business. Okay? I think a lot of people like talk about how you're feeding your baby as like an icebreaker, like just something to kind of chat about. But if that's something that's personal for you, you don't need to be sharing that with everybody, especially when sometimes it feels like formula is a 4-letter word and it's not. And for whatever reason you decided to feed your baby, whatever you decided to feed them, if it's breast milk, if it's donor milk, if it's formula, if it's a special hypoallergenic formula, whether it's a combination of all of those things, your choice should be supported by those around you. You do not need to explain your reasoning or your choices behind your feeding to anybody. It is totally fine to feed your baby breast milk and have a relationship with them that way. It is totally fine to feed your baby formula and have a relationship with them that way. No way is inherently better than the other because we have to take into specifically your situation and what's going on with you. Okay? There are a lot of reasons that people choose to formula feed. One, because that's what they want to do, right? Two, maybe they're taking a medication that's not compatible with breastfeeding. Maybe they've had breast surgery or had breast cancer and are not able to breastfeed. Maybe they have past sexual trauma and breastfeeding brings up a lot of those memories for them. It doesn't matter. It doesn't matter why you're choosing to formula feed. It is a totally fine and acceptable way to feed your baby, and it's one that we need to still educate on, right? It's not like, okay, well, I'm going to formula feed and now I need no education, right? No. So we're going to kind of go from the newborn period and go up from there. Let's talk about brand new babies. So often in the hospital, you will be provided with little pre-filled, pre-mixed 2-ounce formula bottles. And without much instruction, it's very easy to overfeed your baby in those first few days because regardless of what babies are eating, they have very, very tiny tummies. You're going to notice that babies with formula feeding might eat a little bit less frequently than babies that are being put to the breast. So every 3 to 4 hours is what we recommend. So we want to make sure that we are not overwhelming their tummies because sometimes their eyes are bigger than their stomach, and if they get that whole bottle, they will just chug it down very quickly. So this is where making sure that you are listening to your healthcare providers and how much formula they tell you to give the baby in the first few days, watching your baby's cues for hunger, of course, are also going to be important. And then also remembering that paced bottle feeding is something that we can employ even in those first few days of life to kind of make sure that babies are getting their sucking satisfied without taking in too much milk. I have a video all about paced bottle feeding, but basically it's a way to give milk that mimics the flow of the breast so that babies are able to have some sips, drink those down, and take a little break in between so that they are not getting overwhelmed by a large amount of milk and take in more than their tummies can handle, because that's going to make them very, very gassy, very, very prone to spitting up, and just not very comfortable in those first few days of life. We want to avoid that. What we're going to notice is that in those first few days of life, into those first few weeks of life, babies will slowly increase their intake and kind of cap out at about 2 to 3 ounces for the first few weeks of life and then go up from there. So in general, when we talk about formula, and again, make sure that you're reading the directions on your specific brand of formula that you're using, we see babies take about 2.5 ounces per pound per day. So you'll take how much they weigh, multiply that by 2.5, and then divide that over their feeds per day. But also what we know is that each and every baby is unique, regardless of what they are eating. So you might notice that your baby is still looking very hungry after the set amount of milk that they've had. That's when you can offer another 1/2 ounce to 1 ounce with frequent burping and giving them a pacifier to suck on too, just to make sure that that's still what they're interested in. You might also notice that babies are playing around with the nipple, not really wanting to eat or spitting up a whole bunch after feeds. That might mean that perhaps we're kind of forcing them to take in a little bit more than they would. Just like any baby who eats anything, you are going to have formula-fed babies who are in the 1% on their growth chart and are following that curve. You're going to have formula-fed babies who are on the 99th percent of their growth chart and following those curves. And both of those are okay and normal. What's important is that babies are having pees and poops, babies are following their curve, and babies are meeting their milestone. All things that your pediatrician will help you watch for. In the hospital, like I said, you're going to be given those small little bottles, and you'll often notice that those will either be Enfamil or Similac. Those are some brands that are really common in the United States. Those are dairy-based, and most formula is dairy-based, and most of the time that works just fine for most babies. If you have a baby who has a sensitivity to dairy, which you might notice by being really, really fussy, super, super gassy, green poops, bloody poops, things of that nature, then you might need to switch into a more hypoallergenic form of formula. You and your pediatrician can work on finding a good formula for your baby if baby is having issues with a dairy-based formula, but in general, that is what we start out with. Figuring out what you want to feed your baby, be it Enfamil, an organic brand. They have some fancy kinds from Germany. Stick with that in general because your baby will get used to a specific formula and you don't want to switch things up because that can make their tummy feel a little bit upset. It's also important to remember that with formula feeding, with bottle feeding, we're going to be taking in a little bit more air, so frequent burping throughout. So if baby all of a sudden is seeming not as interested in feeding, that is often a good time to burp. And with burping, you have a couple of different options. My recommendation is while you're in the hospital, ask a nurse to show you how they burp. Everybody's going to do things slightly differently, and it's really nice to watch other people do things so that you can figure out what works best for you. You might find sitting on your lap and leaning forward to burp is really useful. Another one that we see a lot is burping over the shoulder. Something that I personally also like to do when you have a little one and you know that there's a burp in there and they can't get it out is just kind of take them, hold them, and kind of swirl them around almost as if you're kind of helping that gas come up to the top and then burping them. Excessive gas is not fun for little ones, and it also can lead to some seriously intense spitting up. I always recommend when you're feeding to make sure that you have a burp cloth handy. That way you can have it under their little chin while they're eating and also have it for burping, because formula is a substance that stains more quickly than breast milk just because of the chemical composition. So being able to quickly treat and throw that in the wash is going to be helpful, and that way you're not having to change clothes all day long. When you go home from the hospital, you've been using those little 2-ounce bottles and probably just feeding them a small amount from that to the whole bottle, maybe by the end of your stay, and then throwing them away. That's not going to be economical when you go home, because babies will start taking more than 2 ounces at a time, and those are pretty expensive. So once you make a bottle of formula, it is good for an hour once baby's lips touch it, once it's opened. You can keep untouched formula in the refrigerator for up to 24 hours. So if you are making some bottles for the night ahead, that's something that you can do in advance and put them in the refrigerator. You also have the option of making one big pitcher of formula in 24 hours and pouring off of that, with the understanding that you might need to throw some out at the end of the day, and you shouldn't be adding more into that pitcher that's already been made, because bacteria and stuff can start to grow after 24 hours in the refrigerator, and it can start to grow after an hour once the baby's lips have touched the bottle. In general, it's good to err on the side of making just enough formula so that we're not wasting formula, and then you can always make another ounce, another ½ ounce if baby's still seeming hungry afterwards. Again, too, when we're giving formula, you might notice that your babies will take it cold or room temperature or warmed up. They'll kind of get used to however you've been serving it. So it might behoove you to get them used to taking it at room temperature or even a little bit cold, just so that you're not having to waste time warming up a bottle when you have a baby who's screaming and ready to eat. But if you want to warm your bottles up, that's fine. You never want to put breast milk or formula in the microwave, and you can put the bottle inside of a cup of warm water, or a bottle warmer is another option as well. It's also really nice when you're going out and about to have things prepared, have a bottle ready to go, ready to be mixed up, not necessarily mixed, right? Because that puts the timer on things, but have it ready to go and ready to be mixed, because you never want to be out and about and not have milk with you to give baby. You want to be prepared. Nobody likes a screaming baby. It frazzles you and your nerves, and babies don't really love to be hungry either. When you're picking out which bottles to feed your little one, it's also important to keep in mind that they will get used to perhaps one type of bottle and not be able to switch easily in between bottles. So picking out ones that are easy to clean, don't have a lot of parts, and also work well for their gas. So sometimes those Dr. Brown bottles are what works great for your baby. And if that's the case, perfect, use it. But it's also nice to try out ones before they get too used to those that have a little bit fewer parts, because those are a lot to wash. And when you're washing 8 bottles a day, it's a lot. Regardless of what you choose to feed your baby, it needs to be breast milk or formula for the majority of their feedings for the first year of life. At around 6 months, introducing solids is a great thing to do, but you want to make sure that babies are still drinking the same amount of formula or breast milk, and if they're not doing so, you actually want to decrease their solids and increase their breast milk or formula to make sure that they are getting enough of those nice, beautiful liquid calories that we are providing them. You also never want to add anything to a bottle of formula like oatmeal or rice cereal, because this can pose as a choking hazard unless your doctor has expressly told you to do so for some sort of reflux issue. It is a medication more so than it is a way to keep your baby's tummy full in this instance. Feeding your baby is a great time for bonding. When you're holding a baby in your arms, the distance from them being held in your arms to your eye is about the distance that a newborn can see. So when they're looking up at you and they're hearing your voice, they are saying, that is the voice that I've heard for the last 9 months. That is my mother. That is my father. That is my sibling. And I am hearing and seeing their voice, and I am having a bonding experience with them. Really use that time to gaze at your baby, to feed your baby, to pay attention to their cues, and to talk with them. And then when you're burping them, it's also really useful to get their heads used to going in different directions, to help strengthen their neck muscles, and to help prevent flat head, that we switch which side we are feeding them from, even if it's a little bit more awkward to us with our dominant hand. Also, the really nice thing about formula feeding is that everybody in the family can be involved in feeding your baby. So pass your baby around as much as you feel comfortable doing. Let somebody else take a late night feed so that you get a nice good stretch of sleep and really enjoy that. I hope that you mamas know that whatever mode that you choose to feed your baby is the perfect decision for you, and I support that wholeheartedly. I also want you guys to know that the most important thing that you can feed your baby is love, and I know that each and every one of you is doing that, and your baby is so lucky to have you. I want to thank you guys so much for watching. Special thanks to baby Carter for your appearance in this video. Until next time, stay well guys. Bye-bye.